Hello everyone. Is it good evening, huh? Good evening, good afternoon, good morning. This depends on whenever you are seeing this video. Henry Daniels, I said I should drop this with you today. I want to talk on pregnancy is not a disease. Yeah. This simply means that a pregnant woman is not meant to die during pregnancy, either as a result of the pregnancy or the complication of pregnancy. Because pregnancy is not a disease. Pregnancy is not a disease. And now, what are the things that normally causes death during pregnancy? I think one of the commonest cause of death in pregnancy is postpartum hemorrhage (PPH), and that could be preeclampsia, antepartum hemorrhage like placenta previa, placenta abruptio. Those are not relevant. Trust me, I don't just want to mention those jargons; they are not necessary. What I want to say is that a woman is not meant to die during pregnancy because pregnancy is not a disease. Now, if a woman dies as a result of pregnancy or the complication of pregnancy, two things are involved. One, it is either the woman was not careful about her own life, or she went to the wrong place. The woman not being careful about her own life is now you're pregnant as a woman. You decided not to go to the hospital to register for antenatal. Not just any hospital, a good hospital. I'm not saying it must be a tertiary or secondary healthcare. Could be primary healthcare, right? But she decided not to register for it. Now let's assume that the pregnancy that she's carrying, that the fetus is not forming in the right place. The right place is the womb, which is the uterus. Let's assume this woman decided not to go to register for antenatal clinic, where an ultrasound will be done to know the exact place where the baby is forming. The baby can form in anywhere in the body. Can decide to even form inside the abdominal cavity, of which the right place where the baby is supposed to form supposed to be in the womb or the uterus. But due to one abnormality or the other, or due to something you cannot actually explain, the baby decided not to enter where he's supposed to enter. Or on his way to where he's supposed to enter, he stopped on the way and started forming there. Without you attending or registering for antenatal or booking for antenatal clinic, you will not know. And this can be a cause of maternal mortality. When you register for antenatal clinic, the first thing they will ask you is, okay, go and do an ultrasound scan. The ultrasound scan is made first to confirm the pregnancy that you say you are pregnant. When you confirm it tells you where the pregnancy is located. And if it tells you that the pregnancy is located in the womb, you are safe. Yes, you are safe. You are good to go. But if it tells you that the pregnancy is not in the womb, meaning the pregnancy cannot continue, something must be done about it. And that is why you must register. You must get booked. When I said the woman doesn't care, it means that she doesn't care about her own life. When you book for antenatal clinic, it means you are caring for your own life as a woman, because pregnancy is not a disease. You are not meant to die. And they do all sorts of tests. Check your PCV, whether your blood is optimal. They check your urine, whether there is any form of abnormality, protein in your urine, glucose in your urine. They do a lot of tests. Now, if they discover that, they check your blood pressure and monitor the pregnancy for you. You get? They monitor the pregnancy for you. And if perhaps something is wrong, they will tell you, madam, something is wrong. And the right thing that should be done will be done immediately. Preeclampsia is not supposed to be a death sentence, in pregnancy. It's not supposed to be a death sentence. All you just need is that you should book in the right place. And someone will help you monitor it. Someone who knows how will help you monitor this pregnancy and help you manage this condition. It can be managed, trust me. But unfortunately, they rush a lot of patients down that to a tertiary institution, and at the end, there's nothing we can do about it because it is too late. Either the woman is going or the baby is going. But if you are registered or booked at the right time, someone would have been there for you to help you monitor this pregnancy, to help you monitor any form of complication that may arise as a result of the pregnancy. As I said, you are not meant to die from pregnancy because pregnancy is not a disease, it's a blessing. Yeah. Pregnancy is a blessing. It's not meant to take your life. All you just need to do is that when you discover that you are pregnant, go to a good hospital and register. When I said two things, the second thing is that you're not registering or booking in the right place. You go to a place where quack, in this part of the world, they practice quackery, People are not even trained to do a specific thing. You just find them doing it. There's one that they brought to us a few days back. He went to school of health. He's not a doctor, he's not a nurse. He did CS for someone and ligated the woman's bladder to the uterus. What is that? And when he brought the woman to us, he was the one who brought the woman. We asked him, who did the surgery? He said he's one doctor. He never said he's the one. It was after he left, we asked the woman, who did the surgery? He said it was the doctor that was here just now. I said, you mean that guy is a doctor? He said yes. But right now the guy is in jail, Because the woman, the whole thing escalated, Everything escalated. They went to arrest him. He's not a doctor. You must not put your life in the hand of someone who doesn't even have experience, who doesn't even know what he's doing, who doesn't even have the license to do what he's carrying out. You must go to the right place. Because you are not meant to die from pregnancy. I don't want to make this video very long. But just know that pregnancy is not a disease, it's blessing. It is a blessing from God. And you are not meant to die from it. The only way you can prevent this, that you must go register when you discover that you are pregnant. You don't need to wait for when it's 5 months, when it's 6 months. No? What are you waiting for? If you go when it's 2 months, it doesn't take anything away from you. When you discover that you are pregnant, immediately you miss your period. Just carry yourself and go and register or book in either a primary health care close to you, or a secondary health care close to you, or a tertiary health care close to you, not in a place where they practice quackery. And you will survive. I'm not saying complications may not arise. Complications will arise when they arrive, but you are in the right place. They will help you manage it, and you will be good. Everything will move, everything will just go smoothly, and you will deliver safely. Friends, if you have not subscribed to this channel, please do that right away. And like this video if you really like it. If you don't like it, you don't like it. But if you like this video, please click on the like button and leave a wonderful comment in the comment section. If there's any question you want to ask, just ask. Whenever I'm free, I will respond to those questions. God bless you. And God bless Nigeria.